Good day, sir. I am Grace Medal Tayopan, your nursing aide for today, and today I'm going to demonstrate routine catheter care. The purpose of this procedure is to minimize the trauma and infection risk associated with a urinary catheter. Next, for assessment, we are going to determine how long has been in place the catheter. Then observe any discharge around the urethral meatus and assess for complaints for pain or any discomfort from the client. Then, wash hands. After wash hands, for planning, we are going to prepare all necessary materials or equipment that we are going to use. Then, for implementation, we're going to wash hands and close the curtain around bed or close the door of the room if applicable. Then afterwards, organize all equipment that we are going to use for perineal care. Then we have to position the patient correctly and cover with bath blanket that is only expose the perineal area. For female, we are going to assist her in dorsal recumbent position while the male client remain in supine position. Next, place waterproof pad under the client. Next, drip both blanket on bath clothes with only perineal area is exposed. Then next, we have to put on gloves. Then apply a sterile drip over patient's perineum. Then next, we are going to pour antiseptic solution on cotton balls for or swabs to know if the client has allergy on the uh, in the uh, ointment that we are going to use. And next, with our non-dominant hand, we are going to gently retract the labia in our female client. So we are going to gently retract labia of female client to fully expose the urethral meatus. Then next, and the catheter insertion site. Then it should be the position is maintained of hand throughout the procedure if where we put the non-dominant hand. Then for male client, we're going to retract foreskin. Then hold the penis shaft, and we are going to maintain our hands in the area, and then we are going to assist the urethral meatus, the surrounding if the tissue has inflammation, swelling, or discharge, Then we're going, if there is a discharge, we're going to note the amount, the color, the odor, consistency of discharge, and we're going to ask the client if he felt any burning sensation or any discomfort. Um, then afterwards, mm, we are going to cleanse the perineal area. For female, we are going to separate the cotton balls and forceps. Then to cleanse the labia majora. Then if we are going to moving down towards the anus, and afterwards repeat uh, the procedure, the process to cleanse each sides. After that, for a male client, while spreading the urethral meatus, we're going to cleanse around the catheter first. Then, clean the using the cotton balls to wipe the circular motion into the urethral meatus. Next, after wiping around the urethral meatus in the glands, reassess the urethral meatus for any discharge. If there is, we are going to note it, the color, odor, and amount. Then next, we have to get new cotton balls to wipe the length of catheter in circular motion along the length and the catheter along the length of the catheter along 10 centimeter or 4 inches. Afterwards, apply antiseptic ointment at the urethral meatus along 2.5 cm of catheter. Then afterwards, we are going to replace urinary tube and collection bag adhering to principles of surgical asepsis as necessary, but at least 8 hours. Then next, we're going to check the drainage. The if the tube there if the tube is no kinks or no coiled. Next, after checking, the collection bag is empty as necessary, but at least 8 hours. And next, we're going to assess the client's safety and if he is comfortable in comfortable position, and we're going to dispose the gloves and supplies that we use. Maybe it was contaminated. Then dispose all contaminated gloves and supplies and wash hands. Then afterwards, we're going to inspect the condition of urethra. Next, for any uh, note for character of urine and assess client's temperature and record on nurse's notes when catheter care was given and assessment of the urethral meatus and character of urine if what is the uh, appearance, the color. Then so after that uh, the the temperature of the client is normal, then the character of urine is um, all right, then all the after the catheter care, the client is back in comfortable position with the with new drape, and that's all. Thank you.